it's do unto others as you would want done to you. So my grandma only speaks Polish. I wouldn't give her a caregiver that doesn't understand her and that doesn't understand her background, right? So it's that humanization touch where now as we kind of age with technology, it's harder to do. But that's why I say it takes a little bit of extra time to find that caregiver. But once you find it, it's a beautiful relationship.
Thanks for joining us, our first international guest.
Woohoo!
Excited to have you. Would love to hear more about you.
Sure. I'm a registered nurse by background, and I started Infinity Healthcare about 5 years ago with my best friend. So I've been in home care for almost 17 years, and I kind of fell into it, and I worked for the federal government and for Treaty 8 First Nations. And I was only supposed to be up north for 1 month, but that 1 month turned to 5 years.
Wow.
So I really fell in love with it. And, I thought I was going to start out with pediatrics, but then fell into senior care and just fell in love with it. And here I am, 17 years later, still doing the same thing, but started my own thing. And it was a really risky move, starting a brand new home care company during the pandemic. But then now, 5 years later, we have 89 staff and keep growing.
Wow. And what are all the services that you offer? I know home care is the main, but you have 5 or 6 core competencies that you focus on.
Yeah, so 30% of our business is helping care for children that have disabilities. We also kind of fell into that. It was a friend of mine from nursing school that had a child that needed some care, and she was waiting a couple of years, and I saw a need, and like, we can help you. So then that turned to be a really successful relationship, and then it kind of spiraled that way. And then the rest of the 70% of our business is over the age of 18. So especially with seniors, a lot of the injuries that happen in the home is from housekeeping and doing laundry, because the laundries are in the basement. A lot of falls happen. So we do everything from housekeeping, laundry, meal preparation, which is big because nutrition's a big factor of keeping people healthy in the home. And then all the way up to helping people die a beautiful death at home. And in Canada, we have medically assisted death. So we work with physicians and the palliative home care teams to actually provide a beautiful death experience for not just the client, but also for the caregivers and the families.
Wow. So such a diverse set of offerings all the way from start of life to end of life. I'm curious, you think about, and we know a lot about the U.S. healthcare system and we understand how it works. What are the biggest differences in your eyes from, what you've seen from how care is given, how care is reimbursed for, how care is, the entire care journey in Canada compared to the U.S. for the viewers who may not be as familiar with Canada?
Actually, it's a great question. Our motto at Infinity Healthcare is to bring back customer service to healthcare. And my son was born in Connecticut and at the Yale New Haven Hospital. And we had the best healthcare experience ever. And then I've always kind of resounded back on that experience where they really cared for the individual. So in Canada, we have public healthcare. So it's covered by the province and the country. However, you don't have a lot of choice in the individual providing the care for you. And a lot of Canadians think that whatever healthcare we're getting right now, we don't really have a choice. And that's where the private healthcare comes in, which is what I'm in right now. And 9 years ago, when I started in private healthcare, it was a very taboo topic because people are like, why are we going to pay for healthcare? We get it by the government. So the individuals that wanted higher quality care, higher autonomy on who comes into the home and who's providing the care, those are the individuals that were going into private healthcare. Alberta is now one of the only provinces that has now adopted this program where you can pick a private provider at a very subsidized cost, as low as $2 an hour for private healthcare, which is a win. And this program, you get to choose who comes into your home, how often, and what they do in the home, which is really great. Yeah, and one of the things, so we were named Best Home Care Company in Northern Alberta, no big deal, this year. But part of the reason we do that is because we do something called personality matching. So we don't hire just anybody. So we would come, let's say you're a home care client, Hirsch, say we would do an in-home assessment, and based on that assessment, we would find a caregiver that we think would be a good fit for you. We don't just hire that individual that we think would be a good fit. We would do a meet and greet with you. You would meet the potential caregiver, and if you really like them, great. We have a match. If not, we would continue looking. We don't only do that for you as a client, we do that for the caregiver, because if a caregiver truly enjoys the work that they're doing, they perform better, their mental health is better, and everybody's happy. So that's one of the distinguishing features of what we do. Yeah. And it takes a little bit of extra time to find the right individual, but once you do, it's a really successful partnership.
Yeah, it seems to me like a lot of the ways you've set up your business are because of your clinical background, right?
Yes.
Being in it for 15 years. Yeah, maybe talk to us about how you got started in it and how you take a lot of those values today in running Infinity.
So I have a very unconventional way of how I became a nurse. I graduated 17 years ago during the nursing hiring freeze, and I didn't have a full-time job. I need to pay off my student debt. So somebody approached me to become a self-contracted RN to go up north, so northern nursing, so 8 hours from Edmonton, which is very, very cold, high-level Alberta. I talked to my husband, my then boyfriend, now husband, and he's like, it's only for 1 month. Take it as an experience, an opportunity. You can learn and grow from it. So I took it only because it was 1 month, and that 1 month turned into 5 years. And it has absolutely taught me everything that everything about resiliency and how using your environment around you and being creative and taking from the environment and being creative and using those resources to help support clients. Now, after 5 years, I started working for the provincial government and realized I really didn't like that. And then I moved to France, had a baby, and I did my MBA in healthcare management. And then went to Connecticut for about 6 to 8 months, and then came back to Canada. And I realized very quickly, why did I take a master's in business when I don't want to work for the province? So I took that big risk and took a sales role about 9 years ago to do private healthcare for a big competitor from Toronto called Bayshore. And then in those 3 years, I was able to grow the business 2,700%.
Wow.
And then all throughout those 3 years, my husband kept saying, why don't you start your own thing? Start your own thing. And nope, too scary. Well, you have an MBA. You can do it. Look at all your successes. And I kept saying, no, no, no. And then in 2020, I took the plunge, and it was really tough because we had to pivot the business, because when we started Infinity Healthcare, it was a home care company, but people didn't feel comfortable having strangers come into their home for obvious reasons. So we pivoted, and we supplied RNs, LPNs, and healthcare aides to COVID positive hospital sites. So that's what we did. And then once the pandemic kind of slowed down, people felt comfortable, then we started doing the home care again.
And how do you recruit, right? You have a team of almost 100. What are things that you look for? What are just markers of folks that do really well in your environment, which seems to me how a lot of healthcare should be run?
Yes. What a great question. And I don't know if I'm going to be able to answer it, because our main, my business partner, she is one of the reasons why we're so successful. It's because of the way she hires. We had to hire 60 people in 2020 to provide those staffing for COVID positive hospital sites. And I offered my assistance, and there's 3 people I found, did background checks, met them. They could do all the shifts. She looked at them and said, nope, not going to work. And I'm like, come on, they're going to work. Not a single one of them showed up for a shift. She knew. I don't know how she does it, but she is able to identify reliability, compassion, and the right fit for the actual situation. And I'll give you another example. So we're very, very specific when we recruit. So there's this one family that they asked us, hey, I need you to find this type of individual, and it's very specific. I'm like, give it to me. So she needs to be fair-skinned. She has to be 5'5". She has to wear glasses. She has to have blonde hair, chin length. She has to be thin, and she also needs to wear makeup and have a British accent. And
wow.
like, oh, wow, that's really specific. Can you give me more information on that? They said that their mom had very advanced dementia. And when you have advanced dementia, you can't formulate those new short-term memories. So the reason why she was so specific is because that's what her daughter looked like. So we were able to find 2 caregivers that fit that mold. And then the first one that we brought on, the mom thought that was the daughter, so they had an instant bond. And they were with us for about 3 years until she passed away. But that is how specific we get in terms of asking the right questions. Recently, we had to find somebody that spoke a rare dialect of Ethiopian. We were able to find it. But when you find people from that cultural background that speak your language and all of that, the success rate is super high and people are happy, not just the client, but the caregiver too.
How long does something like that take to even find? I mean, that's so specific, and I'm sure you get inquiries like that all the time.
Yeah. So for every one client, our recruiting department calls 65 to 70 potential applicants. And then they pick their top 4 or 5. And then based on those, we provide 2 to 3 potential meet and greets. So we provide the person we think is going to be a good fit for you. And then you have like a cup of tea with them. And you're like, oh, we really love them. So again, I'm really bad at it. I know my strengths, I know my weaknesses, but I'm really bad at it. I just love everyone.
Yep.
And I want to give everybody a try, but that's not what it comes down to.
So I want to shift to aging in place. You kind of hit on that a little bit earlier, and I think that's one of the unique parts of your business and sort of your philosophy to providing care. Why do you think it's such an urgent issue right now, and all of the conversations you have with your clients and your partners?
Well, there was a study recently in 2020 that they asked adults in Canada over the age of 65 where they want to live, and 96% said that they will do whatever it takes to stay out of a long-term care facility. Mm-hmm. And right now, 1 in 5 Canadians are over the age of 65, and in 10 years, it'll be 1 in 4. And aging in place is important because let's say you have dementia, and what happens as you age with dementia, you lose the ability to formulate those new short-term memories. So if you've lived in a home for 40 years, you can probably close your eyes and make it to the bathroom. But if you change that environment, even though if you have bookcases and picture frames that can help you rekindle a memory of some sort, you won't be able to form that new short-term memory. Where's the bathroom? Where's the couch? Where's this? So there are a lot of ways now that we're working with technology to helping people age in place because that's where they want to stay. And we've been using Alexa, for instance, where there's an individual can't afford private health care, but they want to be able to stay in their home safer. So they're using Alexa to put medication reminders. Hey, did you take your 8 a.m. meds today? Okay, it's an hour after your meds. Let's take your blood pressure. There's that red book in the kitchen. Please write it down. Stuff like that, where we've also partnered with a company called Health Cities, where we're trying to show the government that using technology and not spending a lot of money can help individuals stay in their homes safer and longer. Using a Ring doorbell camera, for instance, you can actually set it up on your kid's phone so that your kids know who's coming in, keeps it a little bit safer. Or if you can't open your door, you can unlock it remotely, right? So there's a lot of neat things that are coming out now to make it a lot safer for you to live at home. Mm. And the best thing is a lot of seniors don't want to learn any new things with technology. These technologies that are being introduced, you don't have to think about. You have somebody install it for you, and that's great.
Well, which piece of technology are you the most excited by? Because I think, you spoke about the Alexa one. Is there any more recent or more cutting edge technology you've deployed in homes?
We're working with a couple of vendors right now through Health Cities where, there's devices that you can keep at your bedside where they'll be able to kind of track your movements as well, but they'll also be able to use all that information and, make it into a summary of what happened, how you're sleeping, what your oxygen rates are, and all of that. There's another one called Neurosantis, which I think is really cool, where it's a device that you wear on your neck, I think for 4 to 5 weeks, 20-minute sessions each time, and it's supposed to significantly reduce your risk of falling and your gait and all of that. So that's really exciting. There's a lot of things coming out now that I'm really excited about, but right now we've been working with the lowest impact technology in people's homes that is not it's not too much to learn and adapt, especially for older adults. Yeah. I mean, I was just saying, if I can go back in time, I would go back in time where my car would be a horse. It was much simpler back then, but technology to me is very confusing. So I can't imagine somebody 85 trying to implement technology, right? Yeah. So we've been giving some of our seniors iPads and that they can control their homes and the lighting and all of that. But we're making it into a very easy way to do that. If there's a couple or a senior that doesn't want to do that, we bring in their kids. So the kids can actually help, turn off the oven or turn on the lights here and stuff like that.
Got it. And you also you have partnerships with both Best Buy and then you spoke
with Alexa. Yeah,
Alexa as well. Yeah, talk to us about that.
So Alexa, everybody knows about Alexa. She's fantastic. So when we do in-home assessments, we ask if they have any Alexa or Best Buy products. Sometimes they do, sometimes they don't. If they're a couple living on their own, generally they don't because it's technology. So what we do is we bring Alexa into the home and we look at their care plan. And it doesn't mean that it has to be a high medical need, but a care plan is like, hey, do you sometimes forget to take your medication? Well, on occasion. If it's on occasion, why don't we just put, hey, Alexa, please provide a reminder at 8 a.m., 9 a.m., or whatever. Or if you're going to go have a shower, have a little reminder, hey, please take out the carpets or make sure to be using your bath chair. Just little reminders like that, because we all know about those little sticky notes that you could put all over your house to keep those reminders. Those can be effective. Or if you're not in the right place at the right time, you won't get that reminder, right? So Alexa can work in all over the house. You can also program Alexa to turn on your lights. They could be on a timer. You can have these floorboard lights too that can help prevent falls and all of that.
Got it. And so if you're someone that's joining your program and you're looking to set up these technologies, how do you assess what is the best for every patient, right? Because like you mentioned, some people, they need things that are really easily accessible. Other ones, I'm sure, are like, hey, just give me everything, right? How do you do that assessment?
There's no blanket solution. Right. Every single person that we see is so very different. We have ones that are like, nope, we don't want any technology, but the kids and family do. So we work with the kids and family, and we have technology in the background without the person knowing it's there. So it's non-invasive. And then there's individuals, let's say they have mobility issues. Well, then that becomes a different situation where we're going to recommend, hey, you have an iPhone or an iPad, you have mobility issues, can't get out of bed to open the door for your dad or your mom or your whatever, then you can unlock your front door or lock it again and stuff like that. So it's completely dependent on where the individual is in their health journey. So they could be very healthy and they have just cognitive issues, or they can have mobility issues, or they're an end-of-life issue as well, right? So that completely changes things too.
Got it. And then in terms of not the technology side, but the personality side or the people side, you spoke about that one example where it was more about the appearance and it sort of made it look like it was their daughter. How do you think about personality matching? Because is a little bit different, right? Like how do you figure out this is the type of caregiver that this client that you're going to work with is going to gel with? And I know you said they meet them, but like what else do you guys do?
So think about that really grumpy old man that it'll take so hard to get to smile. You know that you're going to have a personality that's going to be quick-witted, has a sense of humor, and isn't all too much in your face. So when you do when we actually do the interviews, we tell the caregiver about the individual. Hey, he's very grumpy. He's really hard to make laugh. Have you dealt with that situation? And sometimes it's a question. It's an example like, yeah, my grandpa was like that all the time. I got this, right? Yeah. Or you have individuals where they're at an end of life situation, and what they're looking for is they want that caregiver to fade away in the background and be there when the client needs it and when the family needs it, right? So it's finding that sensitivity, and it's dependent on the individual that we're finding a caregiver for, right? Some people really want people that just know how to cook real great Filipino food, or know how to cook great pierogies, or have a sense of humor. That's really important to somebody else. And at every assessment, we always ask, what are some activities that you love to do at home? We had a lady that used to be able to knit these little hats for babies in the NICU. So she stopped doing that because for some reason, she stopped doing that. So her family told us about that. So we were able to find a caregiver that got her back into that passion, and the caregiver learned to knit with her, and then they're still providing, making those little hats for babies, right? So we gave her purpose back, which is really nice. But again, our assessments usually take about an hour and a half, so we ask a lot of detailed questions. For instance, what are some things that you really love doing? I love horseback riding. Great. We're going to find somebody that has those same likes and interests.
Wow. Why do you think the system, or call it the more generalized healthcare system, almost rejects this approach of being so personalized?
We have 3-hour minimums, which means if a caregiver comes, they have to be there for 3 hours. Like I said, that's all about bringing that customer service back. On the public side of things, they have 15-minute minimums. So if somebody's coming in and they're like, here's your medication, see you later, bye, wham, bam, thank you, ma'am. So we have been told that's that revolving door of caregivers, somebody different every day. They're there for 5 to 15 minutes. So there's not that touch point, and it's a different person every time. So imagine you have dementia and you can't formulate those short-term memories. Who is this? Who is this? Who is this? Every day it's somebody different, right? So, but they also have a wider scope of individuals. I'm not saying that they're not trying to do that, but it's really difficult because they have the entire Canada trying to kind of be looked after. Yeah.
And do you think this is other folks in home care as well? Like, is your approach that you have pretty unique to your company?
Yes.
Or so even when you think about folks going into the home, you don't see this level of personality matching across the board?
I can safely say that I don't think we would have grown as big and as quickly as we have without that personalized touch. And it's do unto others as you would want done to you. So my grandma only speaks Polish. I wouldn't give her a caregiver that doesn't understand her and that doesn't understand her background, right? So it's that humanization touch where now, as we kind of age with technology, it's harder to do. But that's why I say it takes a little bit of extra time to find that caregiver. But once you find it, it's a beautiful relationship.
And then talk to us about outcomes, right? So I think we see clearly, like, just hearing you talk about it makes a lot of sense. Talk about some of the outcomes that your patients have seen as a result of this personalization and technology and your service as a whole.
So most recent example, I guess, she's an older lady. She is turning 105 next week. And because we're able to provide her in-home support, so with the language that she speaks, and we've also implemented technology too, where the family can feel safe that their mom is looked after, but this 104-year-old still lives at home.
Wow.
And it's unheard of, right? So we were able to actually and keep her at home, and that's what she wants to do. And the outcomes are completely client-led. So when we talk to somebody, I'm like, hey, okay, so you're doing good now. You have a palliative care diagnosis. You have a terminal cancer. Your cancer is going to get to this point. What do you want to do? Do you want to die at home? Do you want to go to hospice care? What are your wants and needs and desires? And then we work with them. And generally speaking, they always want to stay home. So whatever the outcome that they want, we help achieve that for them within reason, right? Because sometimes they start with 20 hours a week, and then as they end up end of life care, it becomes 24 hours, right? So that that consistency with the one caregiver is out the door because you need more caregivers for 24 hours. But again, we still like to do the personality matching because that's what we do. But the outcomes are completely client-led. So if they want to go to long-term care, which rarely happens, we help support that. We have had people that have gone to long-term care because it just got a little too much for the husband or the wife, but they still chose to take our caregiver with them to long-term care, because a lot of our hospitals and long-term care sites in Canada, they don't have enough staffing to support the people in long-term care. So they still bring our caregivers with them.
Really interesting. Do you guys think, or have you guys worked with partnerships with some of these long-term care organizations?
Yes.
And hospital? I'd love to hear about that as well.
Yeah. So when we had to pivot our business when we started, we provided those staff to COVID positive sites. We started those relationships then. So because we had a good in, I guess, with them, as certain residents in these facilities need a little bit of extra TLC or attention, they bring us. We do the same assessment that we would do in any home because it's their home. And then we provide staffing to that individual one-on-one. It's always one-on-one. So anytime that there's individuals in facilities that need a little bit of extra care or attention, then they bring us in too.
Oh, wow. And then there's cases where they then, after you provide that service, they may actually want to go home because they see the quality of service as well.
We've done that a couple of times, yeah. Well, actually, right after, I think in 2022, we helped 9 people move out of retirement communities.
Wow.
Back into their home, or they already sold their home, but they didn't want to be in that kind of facility. So they found a condo that was all one floor, and then they got the care in that condo because they just didn't want to be there. And actually, to be honest, the main complaint in retirement communities like that is the food. So if anybody's ever thinking about going there, go try the food. It's not very good.
Wow. Yeah. I'm sure that was literally life-changing for these folks.
Huge. Well, put yourself in their shoes, right? It makes a big difference. And I don't want to ever be in a retirement community, and I'm in that space. I see it, and sure, there's a lot of community out there, and the hope is that you get to know these individuals that live in the same community or facility, but they come from such different health levels and acuity. Some people are really, fragile and not healthy, and other ones are, you have a very young 70-year-old that's still doing golf, and they're sharing a facility with 90-year-olds that can barely walk, right? So to find that camaraderie and that companionship is really difficult in certain things, but you don't know what you're moving into because you can't interview everybody there, right? So,
right. Yeah. You started this conversation by saying that the need for home care is going to go up by almost 80% over the next 5 to 10 years, right? What are you and your team doing to prepare for that next, I'd say, phase of growth for you guys as well?
What we're doing to prepare for that is we're really trying to leverage technology with home care. We think it's going to be a game changer for people to stay in their home safely. If you have a home that's not safe, then that's a different scenario, but there's ways to make your home safer, which is also part of the assessment. When the nurse comes in, we have a look at the whole house and little things that you can add and tweak and modify in your home so you can stay at home longer. So we're working with companies that can help provide lifts in your house, stair lifts, grab bars, and stuff like that. So so we are trying to use technology and home care. And also the government with this program where you can get that private health care for $2 an hour. And we also tell people that, anything you buy medically, it's all tax deductible. So keep your receipts if you're just paying $2 an hour. So little things like that we kind of try to help people save money. Yep. If you don't have to pay out of pocket, why would you, right? So even if people come to us wanting private health care at the full rate, a private rate, we still have them go through the government to have that subsidized quite a bit.
Yeah, it just makes it way more accessible,
Huge.
Right? And what are maybe policy changes or things that you want to see from a mindset shift? I mean, this is what you guys are doing, right? But you think about Canada as a whole, right? What types of decisions need to be made over the next 5 to 10 years to be ready for the more aging population as well?
I'm not getting in trouble for this, but I would love more objectivity in how the government assesses home care and the need for home care. So I tell all of our clients, when Alberta Health Services asks that questions, to answer every single question as if it was your worst day and you had no one around to help. And us as Canadians, when we have the assessment come in and you have your sons and daughters there, because we tell people bring as much family as possible. So the question is like, hey, do you need help with your medication? Oh no, dad does that. Oh, okay. Well, who helps you get dressed? Oh, sometimes I do, and I give her bath, but dad does it most of the time. So as Canadians, first of all, it's a deeply uncomfortable way to answer questions, as if it was your worst day and no one to help, because we want to help our mom and dad. We want to help our husbands and our wives, right? But when you answer that way, you become the informal caregiver. So the burden goes on you. So Alberta Health Services is hearing, oh, they've got help. He doesn't need this help. He doesn't need this support. So we had a lady that was 96 years old and got approved for 2 hours a week. So when we reshifted how to answer the question, she got 26 hours a week. So that transformed her life. She had somebody come in to help with her medication, help her get dressed, help her get showered, do some housekeeping and some laundry. It transformed her life and helped her maintain her independence in the home. So, and like I said, it is a deeply uncomfortable way to answer the question, because if somebody says, well, no, I need help with my medication, sometimes the case manager is going to look and be like, well, aren't you at home all day? Can't you help your wife? So that's what we tell individuals. And we know it's an uncomfortable process in a way to answer questions, but it's necessary to get those hours.
Very interesting. Final question for you. What is, you think over the next 5 to 10 years with technology coming in, with some of the bets you're making, just the biggest shift in perception of how people are going to think about home care and people are going to make decisions around home care as it relates to the services and the care they get?
The biggest shift that we've been seeing is a lot of people come to us when they're already at their breaking point for home care, and they could have started this journey long, long ago. Home care can be as easy as housekeeping, helping you clean the toilets, getting on your hands and knees, scrubbing your floors. A lot of the injuries that happen for seniors in the home are from the general tasks, right? Or people that have frozen shoulders, putting on bed sheets. That's deeply uncomfortable. And imagine there's a couple living together, one healthy one and one not, and that one healthy individual gets hurt by doing some normal housekeeping duty. What happens to the other one? And then it's an increased cost in healthcare for the system. So it starts as easy as housekeeping and laundry, and then it kind of evolves with the individual as they age. And a lot of our staff, what we do is we do exercises with them at home. Let's be honest, it's easier doing exercises with people than yourself. And especially if somebody pushing you, right?
Yep.
So range of motion exercises, keeping you healthy in the house all the time. It's great. So the biggest shift that we're seeing is, first of all, we need to start a conversation and educate people out there that home care is not just for the elderly. Home care is for an 18-year-old that just got a diagnosis of MS or something like that. It's just a common misconception that people think home care is for 90-year-olds. It's not. It's if you need help in the home, or you have some sort of identified chronic need that you need help to support in the home. That's the biggest shift, and we just need to start educating people.
And so on that point, what is the right time to think about, okay, you know what, this is the next step that a person needs to take? Because I'm sure folks listening, they may be thinking like, hey, is it too early? Is this the right time? Is it like, how does someone think through that?
So if you're finding yourself struggling with day-to-day normal activities of daily living, it's a good one, AADLs, activities of daily living. So remembering to take your medication, or doing housekeeping, getting your clothes on, showering, that kind of stuff, or cooking, or eating healthy meals, or, anything around the home, if you're finding that it's just a little bit more difficult, I think it's always a good idea to have that discussion with yourself and then bring in family members too. I can't stress this enough, having conversations with your family about what happens if. Have that conversation, because it's better to have that conversation when everybody's a little healthier than when actually it happens, because the stress levels are a lot higher, right? So I always tell families, let's have a discussion all together. So like I said, when we come in to do the assessment, they're already at their breaking point. Mm-hmm. But we always tell everybody at the assessment, bring as many family members as possible, because you get a better representation of what's really happening in the home, because the moms and daughters, the sons and daughters are taking care of their aging parents, but they also have their children to look after. So that sandwich generation, right? So it's really hard to manage the kids and then your parents. So, and then you realize, and then the parents also realize that, wow, my kids have been really doing a lot for us. So we always say, with home care and having home care come in, this gives your daughter the ability to be a daughter again and not a caregiver. And this gives your husband an opportunity to be your husband and not a caregiver. So it's transformational in a lot of families, and very often, very, very often, when they start home care, we hear, we should have started this earlier. So that's why there's that whole education piece. Let's start the conversation early. And I'm in healthcare for 17 years. I'm still learning about our healthcare system. So if you don't know what's right for you, give us a call anyway, because we'll help people navigate the healthcare system. It's really hard going on Google now because you get all these sponsored ads, right? So why not go to a registered nurse or a healthcare team that has been in the industry? And if we don't know an answer to a question and you don't need home care, we'll know who to ask.
Oh, incredible. Well, thanks so much for the
pleasure.
time. We really appreciate it. And yeah, thanks.
Super.